Thank you for joining us on Health Diary. My name is Gladys Gachanja, and today we're coming to you from Ottobock, Kenya, here in Nairobi. Now, according to the 2019 population census, persons living with a disability are getting closer to the 1 million mark. Now, a majority of that number are those that are living with physical disability. So today we focus on one of the solutions for those with mobility challenges, and that is prosthesis. So how affordable and accessible is this solution? What more can be done for most of them, if not all of them, to access this assistance? We answer these and other questions right after this fact of the matter. A prosthesis or prosthetic implant is an artificial device that replaces a missing body part which may be lost through trauma, disease, or a condition present at birth. Prostheses are intended to restore the normal functions of the missing body part. In the past, prostheses were heavy and made of wood, but with the help of technology and innovation, today they are lighter and closely match the function of a biological limb. The type of prosthesis worn depends on the level of limb loss and functional needs, but due to the cost involved, many go without this intervention. Here now is part 2 of the prosthesis conversation. We continue to understand the intricacies behind prosthesis, one of the solutions for those living with mobility challenges. And to help us along, still with us, Moses Gitonga, who is a prosthetist and orthotist at Ottobock, Kenya, and of course Alice Wanjeri, who has been living with a prosthetic leg for a while now. But for purposes of this show, she's actually our model to understand these processes. So Moses, the last time we did the measurement and you sent off the modeling for production. So what does production entail?
Production now, after we get the measurement or the model of the client, now we have to make a socket, something like this one, okay, where we have materials or like carbon fiber that we make so that it resembles the shape of the client, so that now the client will go in comfortably without any pain.
And what materials did you say you use?
Yes, first of all, we use the glass, glass for trial fitting, but later we are going to do carbon like this one, which is quite light and will not break when the client puts it.
And before it became better with time, what did they used to use?
Prosthesis as old as mankind. They have used wood, they have used skin, they have used, like, you know, the captain, the one you see in the
Captain Hook.
Yeah, Captain Hook, you got it.
Yeah.
So we have evolved with time until now we have the bionics currently. So it is an evolution that has been there.
So now from production, and now you move on to the fitting process.
Yes.
What does it entail?
The fitting process now is where now our model has to take the function of the lost limb that went. Okay. So this one, the first thing is to get the alignment correct, because if you have a bad alignment, it will injure other organs like the spine, like all those things. And the second thing is comfort. He has to be comfortable that he can bear weight with it. And he has to be balanced. It has to be not one side that is higher than the other side. As you can see, Gladys, you have a lot of laxity. So that's why we put this corset for her. Ideally, we could have only the below knee prosthesis. Okay? And let's fit this one. Gladys, as you can see, we have a pin here. This pin will go to that hole there, and it will lock, such that it will not come out, okay? Just a minute. So she has to aim. Yeah, you see? You can feel the small, yeah. Can you try to lift up? You see, it cannot come out. That is one type of suspension. Then after that, she has to lock the thigh. Yeah. So we have to support it only to allow the flexion, extension, and not the wobbling.
Okay, so for you, Alice, seeing that you were using crutches and then now you started using a prosthetic, what was the difference? How did you feel the first time you wore it?
Siku ya kwanza kuivaa nilisikia ni kama niko tofauti kabisa. Juu nilikuwa nimezoea kila wakati nikiamka wapi crutches nini, mara crutches hazipatikani, mambo mingi. Lakini vile niliivaa siku ya kwanza nilisikia ni kama ni mguu ingine imemea, nikasikia niko sawa kabisa. Na nikawa comfortable.
Hauko unasikia ni kama utaanguka ama ni mzito?
Siku ya kwanza nilisikia ni kama ni mzito kidogo, lakini with time kulingana na nilikuwa nasaidiwa nikasikia sasa iko ni kama weight ya hii ingine.
And that points to the fact that you have to walk with the patient until they are comfortable in the prosthetic. Okay, so what does that entail?
The first step, we call them the baby steps, is, you can see some few gadgets I have here, is the height, or whether the correct height is there. I have a 0.5 here, and I have a 1 here. We always normally start with that, and we tell the client to step on it and close the eyes and feel the balance. Is she comfortable with that or not? Kindly, can we take a step? Yeah, okay. Give me that. Give me your hands. Close your eyes. How is it? Okay, it's okay? Okay. Take another step. Okay, how is it? It's high. As you can see, a 0.5 height, she feels it, okay? That means she's quite comfortable with that one than this one. The other thing is, please can we go back there? To confirm that also, we have this spirit level, okay? Where we try to check whether she's having, she's balanced, okay? Yeah. As you can see, Gladys, she's quite balanced with this.
What is balanced here? Both her limbs?
They're both limbs. If we are not 100%, we always do the technology and we can get it from the laser posture.
Okay, so
yes.
Is that where we go to?
Yes, please.
All right.
As you can see, Gladys, this is a 3D. It has cameras over here and other cameras there. And it has sensors here. This one aids me to see whether there's weight distribution, whether she's distributing the weight in both ribs. Okay, she's not leaning. The new guys or the new amputees, they normally tend to lean more on this side.
On the compensatory leg?
Yes. Yes. And you can see from the tablet, which shows me exactly how the lines are. The distribution is quite nice. I like it. She's not putting more weight on the amputated side, and this is quite normal. But if it's above 40%, it's quite okay.
So what happens if it's totally off? What do you do?
If it is totally off, we have to, you see the pylon down here. The pylon down here shows where the weight line comes through. So sometimes we have to shift it maybe laterally or medially or frontal or posterior. We have a gadget for that until we get the correct straight line, like you can see here, Gladys.
Okay, so now at this point, you're happy with the patient, they're balanced, so where do they move to next?
This, because now she does not know how to walk, she does not know how to go upstairs, downstairs, off the road. She is trained how to do that.
Okay, so we shall move Alice on to the rehabilitation stage and understand what patients have to undergo to ensure that they are comfortable with their prosthetic limb, whichever kind. So in this case, we're working with the leg. So let's cross over to Becky to give us more details on the same.
We start rehabilitation by making sure that the patient understands how to put on the prosthesis, how to take care of the liner, And by that, we show them how they are supposed to clean the liner every day, because they cannot continue using a silicone liner without cleaning it every day. So they roll it up completely like that. Clean hands. They use warm water thoroughly and soap. We use warm water because if we don't use warm water, like if you just use cold water and you had applied oil on yourself, the skin is also sweating. Cold water will not be able to make the liner clean. So after cleaning thoroughly with soap and rinsing it, you use a towel, wipe the liner completely like that. And then you can either leave the liner to dry when it's in this position, or you can turn it over and put on a completely rolled dry towel inside. Overnight or during the day for maybe an hour or two. This completely dries everything inside so that we avoid infections and fungi, collection of dirt and everything inside because of a wet liner. And after that, we start rehabilitation or continue with rehabilitation, train them on gait training, balance and coordination with the new prosthesis, how to walk on uneven grounds, how to walk on even grounds, how to stand when they are taking a shower if the prosthesis is one that they can use with water, or they can be able to, you know, just walk around with it when it's raining and it doesn't get affected by it.
Okay, so when we come back from the break, Becky will be walking Alice through the rehabilitation process, and we'll also get to understand from Alice how it felt like being able to deal with a prosthetic leg and how, again, that changed her life forever. We'll be right back. Welcome back to Health Diary. My name is Gladys Gachanja, and we've learned so much about prosthesis. And at this point, we are at the rehabilitation point. So what does that entail? Becky, the physiotherapist, is back with us. So where do we go here?
We are going to start with Alice. Alice, I would like to show you how to stand from the chair and how to sit from the chair. So let me see how you stand from the chair. Very good. And how do you sit down? No. So we have to repeat sitting down. It means you hold on to the chair for support. In case you slide or something, then the chair can be able to support you. So let's stand. Good. And how do we sit? You have to feel the chair first. Hold on to the handles and sit slowly and gradually. Great. Always remember that. So now we are going to start walking. We see how you're walking with the prosthesis, if it is comfortable for you. So as you can see, Gladys, she's able to lift off the ground and take a step without feeling uncomfortable or wobbling and everything like that. We also train them on how to walk on uneven grounds. Slowly. Good. You can hold on to something. But normally, we start at the bars when we are training them on how to walk on uneven grounds. Like I said, Alice is already there and she's comfortable and used to it.
Okay, so now that Alice is a pro, can you run with the prosthesis?
I have not given her a tick to run yet,
okay.
But I will do that soon.
All right.
So then we get them off the bars where they can completely walk outside, free movement. Alice, if you're uncomfortable, let me know, but let's keep going. Yes. Most of the amputees start walking and they are looking down and they want to step, observing where they are going. So Alice, you can come back. we get to see these things, like they tend to push the foot on the inside, and that can easily make them stumble. But if every day, they get better. Okay. So once we are comfortable and we know they can walk around flat surfaces without issues, we train them on how to use the staircases and the ramps. So the first time when they start walking down the ramp, we have to use a support because they can easily fall and they have the fear. Walking up the ramp is usually tougher than walking down the ramp.
Oh, really?
Yes, but Alice has mastered this, and I'm very grateful because she came in when she couldn't do that without crutches.
And why is it difficult going down the ramp? Or rather,
Going
up the ramp?
Up the ramp,
yeah.
Because of the force of gravity. And you see, this is a foreign body. It's not the normal leg that they had. So the idea of lifting the foot, and we call it the stance and swing flexion of the knee joint. But for her, since now she has a transtibial prosthesis, it's much better for her. It's equally tougher for people who have amputation above the knee.
So now we test on the stairs?
Yes. So Alice, I would like you to go up the stairs. Are you okay and confident? Yes. Good. Good. And how do we walk down the stairs? Perfect. Now I can say you've become a guru.
Thank you.
So we are done with the rehabilitation process, and clearly we have established that Alice and her prosthesis have a good relationship. Now on to the quality check. What is that?
It's the most important part of our treatment cycle also, because this is where we get feedback from the patient. We get to know whether they are able to use their prosthesis completely without pain, without any complaint whatsoever. Yeah, so we do different kind of things. We can do a 4-square test, and we can do a 6-minute walk test, where we time the patient, tell her to walk around a figure of 8. If she's able to do within the 6 minutes without getting tired, that's fine. If she's not able to, it depends on what mobility level we actually got from the word go, because we do not expect the elderly to be able to complete the 6 minutes without resting. So Alice, I'm going to ask you to step next, forward, next square, the other side, and backward. Exactly. So once we are sure that she's able to move around the square without falling off, without saying, oh, Becky, I can't do it, then we are completely sure that Alice can be able to utilize her prosthesis back at home and continue with our activities of daily living without any complaint.
So she gets a thumbs up?
Yes.
Okay.
2 thumbs up.
All right. So the question is, these processes we've seen, are they the same ones you follow even with children?
Yes, but now we create an environment where we can do a quality check depending on what age they are. But for 5 years and above, they can easily follow the 4-square and the 6 minutes walk test. They like it. They enjoy doing it. Yes.
And of course now this is where we move on to the follow-up process, because the patient has been given the prosthesis. They can go on to continue with their lives, but you still continue to walk with them.
Yes. So we walk the journey with them. We can give them up to 24 months of progressive check. But we do follow up after every 3 months.
Okay. So for Alice, definitely you said earlier on, maisha yamebadilika, angalau sasa uko independent, lakini kabla upate prosthesis ulikuwa unatumia crutches. Na wakati ulikuwa unatumia crutches, maisha yalikuwaje? Watu walikuwa wanakuangalia vipi?
Tunatembea na mtoto wangu, anasikia mama yake anaambiwa hana mguu mmoja. Sasa ikafika mahali ika-affect mpaka mtoto wangu. So ilikuwa ngumu sana. Wakati mwingine hata anaogopa kutoka nje, nahitaji kununua kitu, lakini naogopa vile watu wataniangalia, vile watasema, na ngoja kufike usiku kabisa ndio niweze kuendea zile vitu nataka, ama natuma mtu. Juu nilikuwa nasikia siko comfortable. Yeah.
Lakini sasa prosthesis imebadilisha maisha, lakini wale wanakuona na mguu wa chuma wanasema nini?
wanashangaa juu wanashindwa naweza aje kutembea na mguu wa chuma. Unapata wanaangalia, wengine wananiuliza, wengine ni kuangalia. Lakini sasa mimi pande yangu hata sioni ni kama ni chuma, juu niko comfortable kabisa.
Na kuna wale ambao wanasema, mguu wa chuma mimi siwezi, afadhali nikae na crutches. Ungetaka kuambiaje?
Ningetaka kuambia iko mzuri kabisa kuliko crutches. Juu wakati nilikuwa natumia crutches, pengine na kanyaga mahali, ina slide, naanguka. Na kama nimeenda kununua vitu, kama ni kwa duka, inakuwa ni ngumu kujibebea ama kushika mtoto mkono wakati tunavuka barabara. Lakini sasa vile niko na mguu, hakuna mahali siwezi enda. So naweza encourage wale ambao wanasema ati hawawezi taka mguu ya chuma, iko mzuri zaidi. Mimi nimeionja na nimeona, so iko poa na iko comfortable kabisa. Hakuna tofauti yangu na mimi niko na chuma na wenye wako na zote mbili.
Lakini Alice, haya yote yana bei. Sasa nani alikuwa anakusaidia, kwa sababu tunajua NHIF inasaidia upande mmoja, insurances upande mwingine, nani aligharamia bei?
Okay, kuna pande NHIF ilisimamia kidogo na ingine tukafanya fundraising hivi ya family na friends, wakanisaidia kupata hiyo pesa ya kupata mguu. Yeah.
But also just from your experience, what are some of those inhibitions that patients or amputees or anyone with mobility challenges has when it comes to taking up a prosthesis?
Most of the time, they would want to get a good prosthesis like the one that Alice has. Some will get support from NHIF, but what type of support do they get? Is it enough to pay for a prosthesis? Because we get these things from Germany. We import them. We pay duty for them and all those kind of things. So when they come here, we can't just bear the burden of the duty alone. The patient also gets to suffer the consequences of paying tax for the importation, specifically for the prosthesis. I would like to urge the government and everybody else, the stakeholders, who can enable this kind of things, the prosthesis and anything that we are getting in for disability, orthotics, the tax. If we really have to pay tax for these items, at least it could be somewhere where we can be able to afford. The insurance companies, the private ones, should be at a position where they can be able to help the patient get full coverage of the prosthesis, because it's like going out and getting spectacles for your use. It's not different, right?
Very well said. Becky, the physiotherapist, of course, we had Moses Gitonga, who is the prosthetist, orthotist, and of course, Alice Wanjiri, who's living with a prosthetic leg. And you have been such a great sport helping us understand the process from a patient's point of view. Well, at that point, we come to the end of Health Diary. But before we say goodbye, here now is a health tip.
Breathing while you're swimming is extremely crucial because you're using your muscles, and swimming is one of those sports that you use many muscles at the same time. So do not hold your breath. That's the first thing. A lot of us swim, we close our mouth so hard, tightly. You want to sort of preserve what is in there. What that does is get fatigued very quickly. So you want to breathe out when your head is inside the water. Always put your head inside the water up to around forehead level. If it's freestyle, if it's backstroke, same level but on the back side. If it is butterfly as well, forehead level. For breaststroke, we try as much as possible to put the entire head, your entire head inside the water. So when your head goes in, you breathe out with your mouth. When your head comes up for air, you open your mouth like a fish. Just the way a fish opens up its mouth. Open up your mouth and get in some air.
It has been such an informative 2 episodes, even as we understood the intricacies of prosthesis. Thank you for being part of the show. And remember, for any suggestions or comments, you can always reach us on our social media handles. My name is Gladys Gachanja, and we have been coming to you from Ottobock, Kenya, here in Nairobi. Until next time, see you.
You'll ask him the question?
Yes.
Or you'll
Madam, correct?
guide her.
Correct? Madam, come there. So, Gladys, as I said,
And then you're not looking at the cameras, you're looking at
Oh, jeez.
Yeah.
Okay, thank you. The height is okay? Thank you. Yeah.